You have been referred for a procedure known as an endobronchial ultrasound, EBUS. During this video, we will be explaining what you can expect from the procedure. Taking a sample is the best way to investigate a potentially abnormal area in your chest. EBUS allows a sample to be taken quickly. EBUS is a routine procedure that uses a flexible tube with an ultrasound probe attached at the end to create images of lymph nodes in the chest and other nearby structures. Ultrasound imaging allows your doctor to accurately locate and examine areas seen on CT scans that need a closer look. During this procedure, samples from parts of lung or lymph nodes that require investigation can be taken with a small needle, which is guided by the ultrasound scanner. The samples obtained are tested in the laboratory to diagnose diseases. This is an important process for you and will ensure that you receive the right type of treatment. Your physician will ask you to not eat or drink 6 hours before your procedure. You may sip water up to 2 hours beforehand, a maximum of 30 milliliters per hour. You will be asked to arrive at least 30 minutes in advance of your appointment time. In the room where the procedure will take place, there will be a doctor who will perform the procedure and at least 2 nurses to support. The procedure can be performed with you laying down and your doctor standing behind your head, or sitting upright with your doctor facing you. The nurses will attach a blood pressure cuff and clip on your finger, which does not hurt, to measure your oxygen levels. A mouth guard is placed between the teeth to keep your mouth a little open while you are sleepy and also protects your teeth. Just before the procedure, you will be given a sedative by injection into a vein to keep you comfortable. If local anesthesia is used, a gentle spray to the back of the throat will make the throat numb, which will minimize coughing and discomfort. This spray can taste of bitter bananas. When you are lying comfortably and sedated or asleep, the EBUS scope is placed in the mouth, past the voice box, and into the lungs. As the tube is introduced in the throat, voice box, and lungs, the area is sprayed with local anesthetic. You may feel some discomfort as the bronchoscope is passed through your voice box. This will pass when the local anesthetic takes effect. You will be able to breathe normally as the EBUS scope is small in relation to the windpipe and the bronchial tubes, but you will not be able to talk. Extra oxygen will be given during the procedure via a plastic tube in the nostrils. No pain is usually felt from the inside of the lungs, even if tissue samples are taken. The only uncomfortable feeling may be coughing, which is a normal part of the procedure. Once the ultrasound imaging confirms the scope is in the correct location, if samples are to be taken, the needle will be passed down the tube and inserted into the target area. The needle may be moved back and forth for 10 to 15 seconds to ensure enough material is obtained. The operator will usually carry out at least 4 separate passes into the target lymph node to ensure sufficient material is acquired. To conclude the procedure, which usually lasts 30 to 40 minutes, the needle and then the EBUS scope are withdrawn. Many operators also perform a bronchoscopy before or after the EBUS procedure to check the airways and to remove any mucus or blood from the airway using suction. The bronchoscope is a tube similar to the EBUS scope that has a light at the end and is placed in the mouth and airways. This part of the procedure usually only takes 5 minutes. The samples collected during the EBUS procedure contain cells, which are then analysed in the laboratory to accurately diagnose your condition or illness. This generally takes at least 5 working days, at which point your physician will call you or have you come into the hospital to discuss the results and the next steps in your care. EBUS bronchoscopy is an outpatient procedure, so as soon as the sedation has worn off, after about an hour or 2, you will be checked and able to go home. You should not eat or drink for at least 1 hour after the test, because your throat will be numb and you would not know if food or drink went down the wrong way. You should not drive, operate machinery, or drink alcohol for 24 hours after the test, and should arrange for someone to collect you from the hospital, as you may feel sleepy for the rest of the day. Your throat may be a little sore for a day or so afterwards. and you may feel tired or sleepy for several hours caused by the sedative. You may also cough up a little blood for a couple of days following the test. This is normal after having a sample taken. You should consult your doctor if after 2 days you have chest pain, fever, or breathlessness, or you continue to cough up blood. EBUS is an effective procedure, but as with any medical procedure, there is a small risk of complications, which may include bleeding from the biopsy, infection after the procedure, low oxygen levels during or after the procedure, a sore throat, and a very small risk of collapse of the lung. All these complications are treatable, but may require you to be briefly admitted to the hospital instead of going home the same day as your procedure. Please inform your doctor or nurse if you are taking warfarin or clopidogrel, if you have had a heart attack or stroke in the last 6 weeks, if you have had an infection of the heart valves in the past or have had your spleen removed. Most patients that have undergone EBUS would describe the procedure as acceptable with a little discomfort and no pain. EBUS is a routine diagnostic tool that uses ultrasound imaging to directly visualize airways. Samples collected during the EBUS procedure will be sent for analysis to diagnose your condition or illness and identify the most appropriate treatment. You should have nothing to eat or drink for 6 hours prior to the procedure. Sedation in the form of local anesthetic or general anesthesia will be administered to keep you comfortable throughout the procedure. No pain will be felt, but you may experience slight discomfort as the scope is inserted. Coughing is a normal part of the procedure. You will usually be able to go home the same day of your procedure, but make sure you have someone to accompany you home. You should consult your doctor if after 2 days you have chest pain, fever, or breathlessness, or you continue to cough up blood. EBUS is an important process for you and will ensure that you receive the right type of treatment. Please do ask your doctor if you have any questions. Thank you for watching.